Welcome, everybody. I'm Mark Peter Davis, managing partner of Interplay. I'm on a mission to help entrepreneurs advance society, and this podcast is definitively part of that effort. Today, we've got Mark Gerson on. Mark is the founder of the Gerson Lehrman Group, aka GLG, as it's commonly known. If you're in the finance industry anywhere in that market, you know of this firm. If you're not, it's one of the quieter, huge success stories in the New York ecosystem. The company's been around for about 25 years. Last reported revenue run rate was north of $500 million annually. This is a real beast in the market. Now, Mark has migrated on to a different path in his life. In fact, when he signed up to come on this podcast, he said, we don't need to talk about business. There's plenty of other business books out there. What am I going to add? And he's being very modest. He's obviously got a tremendous amount of wisdom on that. But his real passion lies in philanthropy at this point. He is proactively making the effort to save lives in a couple of other places around the world. He's launched different organizations, raised a tremendous amount of money. And we spent a lot of this conversation diving into how to think about philanthropy, the right amounts, the right framing. That's where his passion is. So I hope you enjoy it. I think it's extremely insightful. If you've ever been thinking about making donations of any size, this might be a helpful playbook for you to start navigating that. Mark, thank you for being here.
Mark, it's so great to be with you. Thank you.
It's weird that we have the same name.
Well, what percent of people born in our era have the name Mark? Probably not a small percentage.
It's not zero.
No, it's not zero.
It's forced me to use my middle name professionally because Mark Davis on top of it is a bit of the John Smith vibe in the market.
Oh, is that why you use your middle name?
Yeah, it's true.
Interesting.
Every job I had...
why didn't you just come up with a nickname?
I've had plenty of nicknames, but that's kind of weird, right? Like to call yourself a nickname in the market.
Well, you'd have to have started young.
Anyway, it wasn't an issue until I graduated. And I think my first job at Bain, there were 3 other Mark Davises.
Oh, really?
Yeah. And it's not like it was a medium-sized firm, but like everywhere I've been since, there's always more. There's a baseball pitcher, there's a porn star, there's all these different folks. And
You're not the porn star, you are?
No comment.
Okay.
No comment. Okay. All right. Welcome aboard. All right. Let's do a quick background so people know who you are.
Okay.
And since we're friends, this is going to be chattier than probably people are used to. So there's a big company bearing your name, Gerson Lehrman Group. You were one of the founders. Can you give us, the audience, a little bit of a high-level framing? I think most people, I'm going to guess 30-year-old plus or in the finance industry know it, but not everyone does. Can you just give a high-level framing on the business?
Yeah, sure. So we started the business in 1998, and it was the problem we identified in the market that GLG solves is investors and all kinds of other business people in companies, people in professional services firms of all kinds. What we saw is they did some of their most valuable learning pursuant to an investment or a business decision in consultation with somebody else or multiple people. And before GLG, that process of finding somebody who could educate you to help make the better decision was totally serendipitous. I mean, we kept hearing stories of, I met this doctor at a party and he told me he was prescribing this drug and it led me to look into the pharmaceutical company. And we said, well, if you weren't at the party, you wouldn't have met him. And so we said, well, we realized that there's a marketplace opportunity here because there are investors and business people on one side who value this expertise. And then there were all kinds of experts on the other side who were willing to share the expertise. So we set up the marketplace to effectively connect them. And that was GLG. And we started in 98 and really launched what it is today in 99.
And you started out in 98 writing research reports. So you were kind of serving the customer and had one of those experiences where you found the bigger opportunity. You found the vein, which was...
Yeah, we weren't even serving the customer. We were serving the imaginary customer.
No one was buying the report?
Well, so the original conception was that we would publish reports or guides or books that explained how industries functioned. And we never actually asked anybody whether they wanted to read them. We just assumed they did based upon the very limited experience that we as young men had. And we were talking in, I think it was March of 99 with someone who ran an investment firm. And he said, I don't want to read the books. I want to talk to the author.
Huh.
We said, well, why do you want to do that? He said, because my questions are specific, and the odds of a book or a guide contemplating and answering my question are very low or precisely zero. But if I could talk to her, then we'd have a conversation. I bet I learned something interesting and actionable. And so that was the light bulb that went off. And we said, all right, why don't we throw away all the books, which we had actually had done and printed a lot of them, maybe all of them at that point. And we threw them all away and started recruiting more people like the authors of those books.
And the authors come on, the customer would then, the financial services, whoever the customer was, would pay an hourly fee to talk to the person, which would get split a little bit.
Pay a subscription fee.
Okay. And then the person who they were talking to would get paid for the time.
Exactly.
Right. Okay. Now, it was a huge success. I don't know if everyone knows. So just a couple of little details about it for folks listening. Capitalized by Bessemer and Silver Lake, two phenomenal firms. 25 plus years at this point, 25 years.
Yeah, we started in 98.
There you go.
I was 26 at the time.
2021 data available online. 3,000 employees, revenue about $650 million.
Yeah, I don't know where that's probably, I don't know if there are 3,000. I don't know if that was exactly the number, but it's gotten to be a sizable company. We serve all kinds of investment managers, all kinds of professional services firms, companies. There's a lot of value to be had by enabling people to share the expertise they have with those who need it to make better investment and business decisions.
Awesome. Broad questions to take us somewhere interesting. What was the most interesting thing you learned in that journey?
Well, it's interesting. You know, we didn't actually know very much at all about business when we started it, and so that's both a positive and a negative, because when you don't know what you don't know, any encumbrance that, and this is the case for any business. I mean, any encumbrance that may be predicted or projected by people down the line, you don't know it's there, so you just go ahead, and it worked out, and it can work out for any young entrepreneur. So there's a certain benefit to not knowing what you don't know, and there's of course a benefit to knowing more things too. So it's both a plus and a minus.
I've actually wondered about this data on founder stats who are successful founders. What percentage of people didn't know their industry well when they started?
It's interesting. I mean, if you think about a lot of the businesses that we respect, they were started by people in their teens and early 20s.
Mm-hmm.
A lot of them.
Yep.
A lot of canonical businesses. So by definition, those people could not have known very much because they didn't have very much experience. And yet that cohort of entrepreneur has founded some pretty great companies. Okay. Suggesting perhaps that experience might be overrated.
Or it might be a little bit of a liability in terms of containing creative thinking when you get into the core of the problem.
That's exactly right. Because you can think outside the box when there's no box.
Right. And you can reimagine it in the context of modern tools, technologies, which if it was imagined 50 years ago, it was built within that box that you're talking about.
Right. Because part of what experience does is it tells you what can go wrong and what problems can emerge. Right. And I mean, every entrepreneur, could just decide not to start the company because of all the problems that people already tell them there are.
Right. Now, look, you came on a business podcast and you asked me beforehand to not talk about business.
Well, it's not just not talk about business. It's that I think most business advice is boring and trite and repetitive.
Yeah, it's out there. It's commodity.
Yeah, exactly. It's commodity business. People say hire you. So what does a typical business person talk about? They say, well, I believe it's important to hire great people. Thanks. Do great people enter the interview with a name tag that says great person? Like everyone knows that, and it's hard to do.
Okay.
So, when people say like to a business person, what tips do you have? Most of them are obvious, trite, and the difficulties in the execution.
Right. Well, okay. So look.
That's just one perspective.
No, it's good. And I was going to use that as a segue. You wanted to talk about philanthropy.
Yeah.
So here we are. That's the business part. Check.
Okay.
Little introduction to who you are. Why are you wearing the orange coat?
So I wear this orange sport jacket every day, and it's the color of United Hatzalah of Israel. So United Hatzalah of Israel is an organization that I co-founded more than 20 years ago. I co-founded with Eli Beer. Eli's the real founder. I'm the co-founder. And the problem that Eli identified in Israel, but it's the same problem everywhere, is that people die all day, every day, waiting for an ambulance. So when you call 911 or the local equivalent, it'll take an ambulance in the most advanced cities 10 minutes to get to the patient or the victim. And if that person is choking or bleeding or having a heart attack or a stroke, they're probably dead by the time the ambulance comes. So Eli's insight was that we could separate the first response from the ambulance service. So if someone who calls the Israeli equivalent of 911 can get help in the 3 minutes and ultimately 90 seconds that separate life from death in a lot of cases, someone who would have otherwise been dead can now be alive. So the solution was to create a crowdsourced system of emergency first responders. And we would know where all the first responders are, and they're all trained EMTs, because you have to be trained in everything, because you don't know whether the call is going to be for a sudden birth or a car accident or a child choking or somebody drowning. So you have to be trained in everything. So the idea was that if the EMTs are just doing whatever they're doing through the course of their day, working, sleeping, having Shabbat dinner with their families, wherever they're doing, when there's an emergency in their immediate vicinity, if they could be contacted and equipped, they could immediately get to the victim and begin rendering treatment in those precious moments following a trauma that can separate life from death. And the ambulance can come 10 minutes later. And it's fine because the patient's being treated, he's alive, and then the ambulance medics can continue the treatment and evacuate the patient to the hospital.
So the EMT is not on duty, right?
Exactly.
And they're just they're on with the rest of it. Is it a mobile app? How do you facilitate the communication?
Yeah, exactly. It's exactly right. It's a mobile app on the phone, and we're able to immediately locate the closest trained and equipped first responders. We know what equipment they have. We know what their level of training is, which is sometimes important for a particular case. And that person, exactly, they're always on, or they're on whenever they want to be. So they may be having dinner with their family and get an emergency that somebody in an apartment 4 floors below is choking. And they immediately rush out of their apartment, go to the victim, render the care, and in that case, God willing, the patient would live as a result.
Does this solution exist elsewhere?
No.
Not necessarily through your organization, but broadly?
Not at scale. I mean, the then lieutenant governor, wonderful man, Adam Gregg of Iowa, was in our headquarters in Jerusalem 3 years ago. And he called me when he got back to the States and said that he felt called by his faith, his Christian faith, to bring this to Iowa. Because Iowa has a similar response time problem, not because of traffic, which is the issue in cities, but because of in rural areas, it's just one thing is so far from the next. So an ambulance is not going to be close to a victim because the space is so vast. So so he had a dream to bring it to Iowa, and he's done it.
That's
so
great.
But it's all throughout Israel and then in Iowa, and it's been our dream to make this Israel's gift to the world, particularly the United States, and to bring this system everywhere so that people who call 911 can get the help in the moments they need. But we have not succeeded in that. Outside of Israel, we've not succeeded in bringing it anywhere else at scale.
What's the constraint in the U.S.?
Politics.
Tell me more.
So the system requires a volunteer culture. The United States has a volunteer culture. Americans are a volunteer people. Americans love to help their neighbors in need. And if this was launched, we had a several-year experiment in Jersey City. It went very well, ended during COVID. But I remember talking with the mayor at the time, Steve Fulop, great man. And Steve said, wow, I'm shocked by how many people signed up in the first hour to be volunteers. But really weren't shocked because America's a volunteer culture. Americans want to help. You need local funding capacity. Obviously, America has that. The problem is politics. And the politics are not easy to explain. It's just a lot of EMT services, they don't want a volunteer component that's going to be outside of the mainstream organization. And
is that a money issue? They see it as competitive?
Well, it would be a part of them, so they really shouldn't see it as competitive because the vision would be, this is the first responders. So the first responders ideally would get there immediately. So Mark, if you were in the system and somebody 2 floors below were having a heart attack, you'd have a full medical bag right there. You'd rush out of this discussion and be 2 floors below within a minute, rendering treatment to that person. But as part of the EMT system, then the EMT medics would come 10 minutes later and continue treatment and bring the patient to the hospital. So no, it's a lot of union issues, but we're not discouraged. We would love to bring this to the United States, and if anyone listening or watching has a contact in EMS or actually at any level of really state and local government, just please reach out to us. And our dream is to bring the system everywhere and to enable people who have these heart attacks, choking, bleeding, strokes, the same chance at life as those in Israel do.
That's great. No, if people are interested, reach out to us directly. We'll also put a link in the show notes.
Yeah.
Now, the orange jacket question is a big one because
so the orange is our color because orange is the safest color at night.
I know, but everyone knows you as the guy in the orange blazer, but they don't know why you wear it.
Oh, well.
It's your trademark move. But
yeah. Well, it's kind of like wearing a billboard. So the reason why I wear the orange jacket, well, there are a couple reasons, but the primary reason is I want people to ask, why are you wearing an orange jacket? And then I could tell them about United Hatzalah. And in so doing, I mean, every year because I'm wearing the orange jacket, 2 to 4 significant donors emerge.
That's
just
amazing.
because of conversations that start. Because I love talking about it because so many people are inspired to help. And if someone saw me in the orange jacket and asked me about it, and then they said, I'd like to bring it to my city, well, that would be a great outcome.
What's the cost of saving a life? And this is when people think about donations and philanthropy in that context.
Yeah.
Something like this program. How do you measure the value of the donation? What's the cost of saving a life in this?
Yeah. So we value everything in terms of ROI. I mean, everything that my wife, she's a rabbi, everything that she and I do philanthropically, we measure through ROI. And volunteer EMS first response service has some of the highest ROI in the world. And you can measure that by the term, it's disability adjusted life year. So a disability adjusted life year is a healthy year. So we always ask the question, how many disability adjusted life years, DALYs, how many DALYs can we buy per dollar? And it's very low with United Hatzalah. And the reason is because everyone's a volunteer. Now, it costs a lot of money to train them. I mean, relatively. I mean, it costs money to train them, to equip them, and to notify them. It's a whole system. And but if we can get to a child who's choking, or to a young mother who's having a heart attack or a car accident, and save some people who otherwise would have died waiting for an ambulance. I mean, in that child's case, children choking happens all the time. We save them all the time. Let's say a 4-year-old child choking, we save them. Now they have 60, 70 years of quality life ahead of them they otherwise wouldn't have had. And that intervention is going to be in the low hundreds of dollars.
Got it. So do you have a stat you tell people who are maybe going to invest or donate on hey, for every X dollars, you're gonna save a life?
Well, it's hard to know exactly how many lives are saved, but we can certainly estimate. So about 6.9% of calls to any EMS system are what's called potentially life-saving interventions, PLSIs. So let's say you could save half those lives. And some people die. Like sometimes you get a call from a heart attack and the person's dead.
Right.
Dead before the call was made. So, we battle the angel of death all day and don't win all the time, but no EMS service does, of course. And, but so let's say half or a third, let's say just a third of that 6.9%. So then you're saving 2 to 3% of calls of people who call, and we get 2,300 calls a day. And, so, the budget, it depends if you count capital or you don't count capital. So
keep it simple.
Yeah, somewhere between $60 and $85 million a year. So, and we're doing 2,300 calls a day. So several 100,000 calls a year, saving, you could say we're saving 2%. And even when you're not saving the life, sometimes if you get to someone who's choking, you've prevented brain damage. If they would have lived anyway, if someone had come 2 minutes later.
Yeah.
If a woman is giving birth suddenly, she may not have died in childbirth, but you enable her and her child to have a healthy birth experience where otherwise it might have been very dangerous.
Yeah.
So it's very high ROI, both in terms of lives saved and years enhanced. So
that would have been enough, but it's not all you've done. Tell us about Africa Mission Healthcare Foundation.
Yeah, so in 2010, I co-founded with my great friend from college, John Fielder, Africa Mission Healthcare, AMH. And in 2001 or so, John called me and he said, as you know, I'm a Christian. And he said, and he had just finished his residency program at Hopkins. And he said, I feel called to serve those whom the book of Matthew calls the least among us. And he said, those are people who are dying and otherwise being ravaged by HIV and AIDS in Africa. And John's an infectious disease doctor. So John went to Africa 25 years ago as a Christian missionary physician. And John was personally indispensable in treating enormous numbers of people with HIV and AIDS. And his work was greatly helped by President Bush's PEPFAR program, the President's Emergency Plan for AIDS Relief, which was the most successful United States international intervention since the Marshall Plan, which saved tens of millions of people in Africa and elsewhere, but particularly Africa, who would have died of HIV and AIDS, and has given them a healthy life. And so John traveled throughout Africa, helping to administer PEPFAR. And one of the many things he learned in that process, and one of the many things he taught me, is that most people in Africa do not have access to quality health care for almost anything. And he said the people and the institutions who are providing the care that exists, care that's dependable, care that's growing, care that's compassionate, are Christian missionary doctors at Christian missionary hospitals. And for a variety of reasons, they were effectively abandoned in the field in the last several decades. And so John's vision behind African Mission Healthcare, which became our vision, was let's partner with these Christian missionary doctors at these Christian hospitals throughout Africa to provide clinical care, to do training so that there'll be more and more doctors and other providers in the years to come. And so we do clinical care for the poor, training, infrastructure building, which could mean a lot of these hospitals don't have oxygen. So we've built oxygen at many hospitals. That could be they need solar power so that power doesn't consume 30 to 40% of the budget. So clinical care, training, infrastructure, and sometimes hospital administration. And the training is a crucial component because in some countries there's one doctor for tens of thousands of people. Not one specialist, one doctor.
That's crazy. I think people here can't even...
They can't imagine.
Yeah, I can't imagine it. I mean, I'm sure I do. We take the healthcare for granted. We complain about a wait time. Right, with no context of what the alternative might be. Yeah,
I mean, in a lot of the places we serve, now we're changing this in the places we serve, but if a woman needs a C-section, she has a 20% chance of getting it. So our goal is to raise that significantly and immediately, because this is a good example we were talking about before with Dali's disability adjusted life years, because if a woman needs a C-section and does not get it, she will either develop significant birth injuries, which are completely devastating, and they will last until she can get surgical treatment, which she will not be able to get because there's no surgery around. That's kind of the whole point.
Right.
And she may lose a child in childbirth. And if she has one of these devastating birth injuries, she won't be able to really be the kind of mother she would otherwise be to her other children. So this is an example of how incredible ROI that effective philanthropy in medicine. I think the highest ROI is to a missionary physician serving in Africa is that the cost of providing a C-section where we do it is about $300, $350. Sometimes actually less, but let's just say it's $300, $350. That woman now gets the C-section, so she has a safe birth. She and her child go home healthy, and she could go back, when she goes back home, she can now be the mother of her children, the contributor to her community that she always expected to be, and not be just devastated by a terrible injury or even worse, die.
I'm sure it's inaccurate, but the public information on the foundation is that 65 million plus has been invested in Africa at this point through the foundation. Is that right?
In total, that's probably about right. Well, yeah, maybe. I mean,
that's
maybe
a
little more.
C-sections.
It's a lot of C-sections. I mean, yes, it's probably more than that now. It's probably more than that. That information is probably a little dated, but it should be a lot more. I mean, it's if somebody wants to save lives or ameliorate pain in the most cost-effective way, the best partners to have are Christian missionary physicians or Christian hospitals in Africa. So the budget now is $12-13 million a year, but it's been growing, and we give as much money as we possibly can because the ROI is so spectacular. I mean, talk about Dali's. I was actually just asking ChatGPT. I think it was a week ago, a whole bunch of questions about Dali's, and it said the most cost-effective intervention as measured by Dali's is Goodell Hospital in the Nuba Mountains. That happens to be our partner in the Nuba Mountains. Huh. And the missionary doctor who has been there since 2008 and is a true hero. I mean, a hero, and I encourage everybody his name is Dr. Tom Katina. I encourage everybody Peter Attia did a great podcast with Tom. Nick Kristoff of the New York Times did a great piece on Tom, and Fox News did a great piece on Tom. So it's all out there on Tom, but the ChatGPT cited a study from Duke University that said that Tom is able, his surgeries cost $73 per Dali. So $73 can get a healthy year. And it's a lot less in some cases. I mean, when Tom does C-sections on young mothers, obviously the cost, I went through ChatGPT, the cost is under $10.
So you're framing all of the philanthropic choices around ROI.
Yeah.
Which I love. It resonates with me as a way to think about giving. Now, what's interesting is I noticed earlier in this conversation, you called it effective philanthropy. And there is another phrase that was out there, effective altruism, but it's got a really bad rap because it got associated with a couple of criminals, right? So is effectively, whether it's you call it philanthropy or altruism, that's the core foundation for how you think about giving?
We think about how many lives can we save and how much pain can we ameliorate per dollar invested.
How did you come to that framework?
Well, because it's a business framework. So getting back to what we were talking about before in business, every business person, every investor, they deploy capital, whether making an investment, and it doesn't matter whether the investment's external in someone else's business or internal in your business, but it's the same thing. It's a deployment of capital. Every business person deploys capital either intentionally or instinctively with a lens on ROI. When it comes to philanthropy, a lot of people abandon this discipline, but they shouldn't, because it's just more deployment of capital. So the deployment of capital should always be governed by ROI.
You and I are highly logic-oriented folks. A lot of people I feel like with the philanthropy, they donate to things that they're either emotionally connected to or they feel guilt for not doing it. It's the local religious institution or the cause for some adverse medical condition or social symptom that had affected them directly or a family member.
Right.
So it's something that they've bumped into. And the beauty of what you're describing, I think, look, you could look at the United Hatzalah and say, hey, he's pro-Israel, he's a big Israel orientation guy,
Sure.
right? He's helping his own people. But when you get to African Michigan healthcare, you have no on-paper affiliation or identity connection with that outside of the math made sense.
Right.
It's called calculation in the best of ways. Is
Well,
that the
so-
right way to frame it?
So that's certainly that's certainly an important aspect of the framing. The other is that my wife and I are devoted Jews, and the Torah commands us to love the stranger, and the Torah never commands us to do what we would do naturally or without its guidance. The Torah never. There's no commandment, "Thou shalt love thy children," because everyone's going to do it. You don't need to be told to do it. You're going to do it. But the Torah says over and over again, you should love the stranger. Why? Because it's unnatural and it's difficult. The typical reaction to the stranger is either fear. This is actually where the word barbarian comes from, someone from out of town. So it's either fear or just either fear them or ignore them. Those are the two natural reactions. In comes the Torah and says, you should love the stranger. Now, in Judaism, love is not an emotion. It's what Rabbi David Wolpe calls an enacted emotion. So love can't exist outside of action. So the Torah commands us to love the stranger. We have to say, okay, how can we act best accordingly? And the answer drew us to Christian missionary doctors at Christian hospitals in Africa.
Right.
But I would say, take the ROI. I think you raised a really good point. So let's say someone has come in contact with, let's say, a rare disease, because God forbid it hits them or their family.
Yeah.
One could look at that and say, well, God has called me to cure this rare disease, or do what I can to cure this rare disease. Now, how do I do it in the most cost-effective way?
So you think it's okay when people take a personalized filter and then look for ROI-based solutions in that bucket?
As long as
it seems that you've taken a non-personalized initial filter. You stacked the known universe, which is that's where we're all limited. We don't know of every opportunity. And you stacked it based on ROI and picked the top ones. Is that the right characterization?
That's right. Yes, and I think you just made a really important point, which is the known opportunities. When you're instructed to love the stranger, that means you got to expand what the known opportunities are, because the very definition of the stranger means you don't know him. If you knew him, he wouldn't be a stranger. Therefore, he wouldn't be within your known opportunities. So I think the Torah commands us to expand the known opportunities, to use your great phrase, and to find the most cost-effective intervention within. Now, I would say the ROI analysis certainly applies everywhere, but a lot of what counts as charity to the IRS is not genuine philanthropy. If you give to the symphony, the opera, the ballet, and the university, it's probably not charity at all. Now, you might get a tax deduction for it. That's just a nice financial benefit, but it shouldn't be counted in one's philanthropic giving.
Explain why to you, in your definition of charity, that doesn't count.
Because there are really only three effective uses of charity: saving lives, ameliorating pain, and creating opportunities for the poor.
Okay, but that's the definition you have. So why can't someone say, hey, I'm supporting the arts, and that improves the human condition, therefore donating to the opera is okay?
Well, I could say I support the New York Knicks because it improves the human condition. I mean, just because someone enjoys the ballet and they get a tax deduction for it, why can't a guy say, I enjoy the Knicks? I mean, what improve the human condition? Let's measure it. I mean, supporting Dr. Tom Katina in the Nuba Mountains through African Mission Healthcare, we know that improves the human condition because Tom is doing the number of inpatients, outpatients, vaccines, and surgeries that he does for an under $3 million budget is healthcare professionals can't believe it because the ROI is so good and he's so effective. I mean, that improves the human condition. What improves the human condition is if you're a woman in Africa and you previously couldn't get a C-section, but now you can. Whoa, that improves the human condition. I mean, someone who says listening to the ballet improves the human condition. I think listening to Elvis improves the human condition. Doesn't mean I think people should get tax deduction for trips to Graceland, although I think everyone should go.
Could we make the argument that, supporting the arts might have some impact on human condition that's positive? I think that's pretty safe to say. But the ROI in it, if you stack rank them, would probably put it pretty low on the list relative to saving a life.
Right. It would, yeah. In the best case,
this is again someone saying, "Hey, I'm going to fund the thing that I'm personally passionate about, affected by, or familiar with," rather than coldly looking at the list and choosing the thing with the highest ROI.
But it's not coldly looking. So, I mean, the people who've gotten involved with both United Hatzalah and United Hatzalah, one of the great things about it is it treats its EMT force and, of course, its victims are Jews, Christians, Muslims, Arabs. I mean, everybody. So it's but people who get, at least in my experience, as the chairman of United Hatzalah and African Mission Healthcare, people who get involved, I mean, we love it. Like, we want to put as much money as we possibly can into both because there's nothing so gratifying and so enjoyable as saving a life in a cost-effective way. I mean, we love doing it. I mean, it's you can almost say it's selfish because it's so enjoyable and so gratifying. Like, I'm thinking of the donors to both charities that I'm close with and give a lot of money. I mean, there's nothing any of us would rather do with the money.
When should someone start being philanthropic? What's the trigger?
The first time they get $1. I mean, the Jewish teaching is very clear about this, which is Maimonides said that the first thing a recipient of charity has to do is to give. And there are a couple reasons for that. One is that giving is the ultimate expression of dignity. And the Torah envisions a society of dignified people all around, which is true equality as everyone has dignity. And the ultimate expression of dignity is giving. The other is, and again, this comes right from the Torah, the other is that we act in accordance with our habits. And if we start very young by giving what we can at the first possible moment, we'll get in the habit of giving. It'll just be something we do significantly with the amount of money that we have then. Whereas Eli Beer, my co-founder, the founder, I'm the co-founder, he's the real founder, the founder of United Hatzalah, he pointed that to me years ago. He said, when people say I'll give after my next deal, that means they're not going to give. Because one can always get richer, and if someone just wants to get richer and richer personally and then give at the end, they have lost so many opportunities to help so many people along the way. And problems compound faster than money. So nobody can compound money faster than problems compound by themselves. For instance, in Africa, if we're able to help, let's say, a young mother with HIV live a healthy life, what's the alternative? Well, she dies and now her children are orphaned on the streets. Those problems compound, I mean, much faster than any amount of money can. So, but yeah, people who get in the habit of giving, give, and people who don't get in the habit of giving, don't. And there's always a reason to wait, but there's always a better reason not to wait and to give now. And also, the Bible has this very interesting promise. The Bible never makes promises, never makes guarantees, because the Bible doesn't want to be an ATM machine where if you do the right acts or say the right prayers, you get the result you want. Then there'd be no notion of faith. But it does make a spectacular guarantee in Deuteronomy where it says, if you give generously and enthusiastically to the poor, you will be blessed in all of your undertakings. In other words, if you give to the poor, you will become richer, because the blessing in the biblical context is always material. So if you give to the poor, you will become richer. And all the modern studies have shown that to be exactly right. And I've seen, particularly through United Hatzalah, why. It's because people give in community. No one does a Google search and just makes a big donation online. People at United Hatzalah, people give because a donor will say, let me throw a parlor meeting or an event where a United Hatzalah medic is going to come, say what he does. People are in community. They give. 2 or 3 people in that room become inspired to throw their own events and give, and it snowballs so positively. All right, so what does it have to do with getting wealthier? Well, if people give in community, if giving is done in community, and you have to pick somebody to do business with, whether it's a plumber for your toilet or a carpenter for your house or an investment manager for your money, whatever it is, would you rather do business with somebody who you know, trust, and like, and believes that the same thing is sacred or important that you do, or some random guy? So giving never has a cost. It always has a benefit, and both in terms of how gratifying it is, but also in terms of how much money you ultimately make doing it.
How should someone quantify the amount of money they should give? How should people determine that?
Well, that's a great question. I think people should give. Well, the first thing is people should identify the right causes to give to, and we talked about that. I think be guided by the principle of love the stranger, be guided by save lives, ameliorate pain, and create opportunities for the poor. And how much to give? I think people should contemplate how much they want to give, and then multiply it. I think people know they're giving enough, or they can at least think they're giving enough if they feel a little uncomfortable with that last gift.
Mm.
If you don't feel, if you don't say, I'm not, if you don't give money, you think, someone should feel comfortable only when they say, you know what, I really don't think I can or should give this, and then they do it. Then they're giving the right amount. But if it's easy, it's not enough.
Why does it need to be painful?
Well, not painful. It ends up being gratifying. It ends up being gratifying because the Torah is right, that if you give generously and enthusiastically to the poor, you will be blessed in all of your undertaking. But if one is asking the question, as everyone should, how much should I give? The answer is, let me test myself. Let me see how much I can give. It's like, I want to spend this money on this other thing. You know what? Instead, I'm going to spend it on saving lives or ameliorating pain or creating opportunities for the poor. And so I think people should give to that point of discomfort, and what they'll find is it's not uncomfortable at all. And again, my friend Rabbi David Wolpe, when he was retiring, he said, in 40 years of being a rabbi, no one's ever come into my chambers and said, Rabbi, I've hit financial problems because I've given too much to charity. And then I've asked, so my wife and I are very close with the evangelical community. And so we've asked rabbis and lots of evangelical pastors, hey, has anyone ever come to you and said, I've hit financial problems because I've given too much to charity? And to a one, and we've asked dozens of pastors and rabbis, to a one, they've all said, what? No, nobody's ever said that. So if no one's ever said that, then the Bible's right. Then if you give generously, enthusiastically to the poor, you'll be blessed in all of your undertaking. And because it's such a great, like any great investment, one should always want to give more. And everyone who gives has more to give. So as David Wolpe said, no one ever hit financial problems from giving too much. So it's not going to be an issue. The issue is going to be giving too little.
So you've also done a lot of media, right? You had a podcast. You're obviously very versed in how to work through this situation, this conversation. You've got 2 books. One has an addendum, a workbook that goes along with it.
Yeah.
Why are you investing time in producing content at this point?
So, well, I haven't done an episode of the podcast for a while because I found, so my last book, which came out in June, is called God Was Right, How Modern Social Science Proves the Torah is True. And what I found is that I had time to either do the podcast or write the book.
Right. I think your last podcast was in 2024, maybe.
Yeah, if that. Yeah, maybe even earlier. Yeah. But I didn't. But
it's in the same vein. You're giving back through content in some form. What's the motivation for you?
Well, I would say about 20 years or so ago, I fell in love with the Torah, and I realized that, and I fell in love with the Torah by way of having studied the Haggadah, which is the guide that leads us through the Passover Seder. And the Haggadah is basically the greatest hits of the Torah. So the Telling, which came out in 2021, it's called The Telling, how Judaism's essential book, the Haggadah, reveals the meaning of life. And then the book, which I started immediately upon the conclusion of that book tour, which was truncated due to COVID, was God Was Right, How Modern Social Science Proves the Torah is True. So what I found about the Torah, the Bible, is that it is the ultimate guidebook. It's the ultimate self-help book. It shouldn't be in the religion section of bookstores. It should be in the self-help section of bookstores because it provides us with the guidance about all the questions, problems, challenges, issues that we face on a daily basis today in 2025. It's the most interesting, compelling, relevant, and useful book, and I love studying it, and I love writing about it.
So now you're running 3i. I'm a member of 3i. Do you want to give an overview of the group?
Oh, sure. So I co-founded 3i members 4 years ago, exactly 4 years ago. And I co-founded it with Billy Libby and Teddy Gold. Teddy is the CEO. I'm the chairman. And we started 3i. The initial conception was answering the question, how do we find more deals like the kinds that we wanted to, that we'd invested in previously, that we wanted to have more of them. And these, we said, let's exclude venture investments and focus on non-correlated, high-yielding income streams that yield between 20 and 40%, often in real time, and have no drama. So we said, well, these are out there because we've done them. They're hard to come by. So how can we systematize a valuable but irregular process? And we said, well, why don't we create a community of the best private investors and set up the systems and structures to enable people to share deals to enable the most compelling deals to surface, and for people to help each other diligencing those deals, and ultimately to invest whatever they want in their own name, with the benefit of the community diligencing them and the community surfacing them. So entirely crowdsourced model. And so the investment part's going great. I'm doing around a deal a month and through the system. And but what we didn't anticipate in the earliest days was just how strong, abiding, and gratifying the community would be. A lot of our members, including myself, have found that many of our best friends and closest business partners have come out of the 3i community. And so now, in addition to the deals, and 2 deals surface from the community each month, we're doing around 300 events a year, in-person events. We have very active channels on WhatsApp and elsewhere to enable members to connect with each other when they have common business issues, common personal issues, common ambitions, opportunities, dreams, challenges, whatever it is. And we found that the community has been just so important and so enjoyable, and the deals are working out great too.
And the community is growing like wildfire, safe to say, right? It's in numerous cities now around the country.
Yeah. So there are about 700 members now, and we have full communities in New York, South Florida, LA, San Francisco, Toronto, Austin, Tel Aviv, and full community. We have a dedicated full-time professional on the ground serving those communities, which are growing. And every member invests significantly and eclectically and is really community-minded. And when someone reaches out and says, this is one that just came in the car right here. Someone said, my parents are traveling to Japan, and they want to understand how the culture has been evolving in the last decade. Other members live there and say, "Oh, I'm here to help. I'd love to help them and show them around." That kind of thing happens all day, every day. That was just the one that happened in the last hour. But these things happen all day, every day. Members are always just there for each other because they're kind of bound by the culture of 3i. Not a legalistic bond by any means, but it's just part of the culture that members are there to help each other. Members love helping each other. Members love knowing each other, meeting each other, working together on things. And it's become a great community and a great source of investment opportunities.
Who should be raising their hand or reaching out to 3i to join? Like, who's it a fit for?
So our members are really four types. They're founders who've had some liquidity, people who run funds, people who run family offices, corporate executives, and professional athletes. And so if our members fit in one of those categories, they invest significantly, eclectically. They're intellectually curious in the sense that when an investment opportunity comes up, most of these opportunities are pretty esoteric. So if someone says, "Whoa, how do they make money doing that? That's interesting. I want to learn more." That's a great sign. And if someone's really community-minded, if someone loves to meet new people who are successful business people and community-minded people and loves to engage that way, that makes for a good 3i member.
Mark, you've been very successful. And I don't just mean economically, I mean in creating impact through the 3i community, also the nonprofits. What's giving you the most meaning at this stage in life? What do you wake up and look forward to?
So my wife and I are blessed with 4 children. So of course, our children. But outside of our family, what gives me the most gratification is the charities I chair. Our goal commercially is to make as much money as we can so we can give as much money to do those 3 things: save lives, ameliorate pain, and create opportunities for the poor. And when someone gets invested in, literally and figuratively, in a charity with really high ROI in one of those categories, the response is, let me just give as much as I can to it financially. Because no one should ever say it's only money. Both my partners in African Mission Healthcare and United Hatzalah say, without the donors, we'd be working with Band-Aids. There's no such thing as only money. So business and philanthropy really go very well together. And this is actually in the Bible why Zebulun and Issachar are blessed together. When Moses is blessing all the tribes at the end, Zebulun is the international businessman, and Issachar is a student, and they get the blessing together. Issachar's blessing actually comes first. Because without Issachar, Zebulun's blessing comes first. Zebulun's the international businessman, because without Zebulun, there can be no Issachar. So, and I think that's kind of a beautiful expression by Moses in saying they get blessed together. They weren't twins or anything, but they got blessed together. They didn't have to, but Moses decides to bless them together because what he's teaching us is that the international businessman and the man of spirit, and that could be, and the man of spirit, we could define that easily to be the missionary doctors in Africa or the medics at United Hatzalah or someone else like that who someone else, another philanthropist might support. They go together and they need each other. And it's done well, it can be a real partnership. So our goal in business is to be able to give as much money as we can to these organizations, which give us this spectacular ROI.
Thank you for being on.
Oh, Mark, such a great conversation. Thank you.
Huge thank you to Mark. He's awesome. We're becoming friends over the last couple of years. I'm very grateful to have him on the podcast, sharing his wisdom. I've always found my conversations and exchanges with him to be deeply insightful. So I hope you enjoyed it, and we'll catch you next time.